As a dialysis nurse, every week I see patients fight for their lives on dialysis machine. And honestly, it's not a beautiful sight. These are individuals who had no idea about dialysis. These are individuals who never imagined that their kidney would one day fail, both young and old. And one statement they usually make is this: I wish I knew better, and I wish I knew earlier. Hello guys, I'm Nurse Juanita, your host on Nurse Juanita Dey Talk. And today I bring you the topic, what your dialysis nurse wishes you knew before it's too late. And today we're going to be talking about daily LD habits, silent warning signs, and the truth about kidney health that could save you or someone you love from dialysis. So today, we're talking about something really, really dear to me, something really close to my heart, your kidneys. Now, many of you really do not care about your kidneys until something goes wrong, or you start feeling some sharp pain behind your back, or you start noticing some changes in your urine production or your urine color. You start rushing and thinking of what you're going to do. But one thing that we should know is that our kidneys are working every second of the day. Think of your kidney as your body personal cleaning system. Yes, they filter waste from your blood, they remove excess water from your body, they balance important salts like sodium and potassium. They also help in the production of red blood cells. You see, two small organs, small but mighty. When they are working, you don't feel it. When they stop working, your entire body feels it. So here's the first thing your dialysis nurse wishing you. Kidney disease does not shout. It whispers. Especially in the early stage, it does whisper. There are so many people going around town right now with kidney damage and they are oblivious about it. They are not aware that something is going wrong with them because there is no pain, there's no warning, nothing. Now, by the time symptoms start showing, symptoms like swelling of the legs, extreme tiredness, severe weakness, and difficulty in breathing, is going to already be too late and the damage is already too severe, too serious, and sometimes irreversible. So yes, routine checkup saves a lot. Routine checkup saves lives. A simple urine test, a simple blood test can tell you so much about your kidneys that could save your life, that could save the life of your loved ones. So get those regular checkups done. Ensure you see a physician. Ensure you do your regular checkup. Now, if I sit down with 10 people on dialysis machines, majority of them are there because of two things: high blood pressure and diabetes. Yes, you heard me right. Now you may think, oh, as a young person, this does not concern me. I feel okay. I don't feel like I have any of that. I eat well. I do this, I do that. Sorry, your kidneys, they don't feel okay. Your kidneys notices every spike in blood sugar level and every spike in blood pressure. So if you know that you come from a family where they have diabetes, they have hypertension, as a young person, you shouldn't take this lightly. You shouldn't take this lightly. Check your blood sugar level regularly. Check your blood pressure regularly. If you are diabetic, diet control. Ensure you take your medications regularly and ensure you care for yourself properly. If you are hypertensive, stick to your medication. Reduce sodium intake. Another thing your dialysis nurse wishes you know is that painkillers are not your friend. Stop popping painkillers as though they are sweet. Stop taking them as though you are chewing gum. I get the fact that you are in pains, but have you seen a doctor concerning that pain that you're having, that leg pain, that back pain, that waist pain that you're constantly having? Have you seen a doctor about it? I advise that you seek the advice of a medical personnel, a doctor precisely, so they can advise you on what to do and how better to manage it. Not you going to one chemist man and seeking for pain meds every day. In the morning, they miss one mixture for you, painkiller. In the afternoon, body release. In the evening, body pain and all of that. They are damaging your kidneys. You might not be feeling it now, but your kidneys are taking a major hit of those things that you are taking. Seek the advice of a medical personnel today and your kidneys will thank you. Now, someone may say, I drink a lot of water. I drink 3 to 5 liters of water in a day. So my kidneys must be really healthy. My kidneys will be thanking me for drinking lots of water. I'm not going to rule out that fact. Yes, drinking water is good. Drinking lots of water is good. Staying hydrated is good. Yes, I'm not going to rule out that fact. But I would like you to know that drinking lots of water is preventive and not curative. If your kidneys are already damaged, I'm sorry to say, there is no remedy. Drinking lots of water is not a remedy. Drinking lots of water is not going to revive your kidneys that are already damaged. Yes. So please, while we take lots of water, let's also remember our overall health, dietary modifications, sedentary lifestyle. I'm going to talk about that. maybe in the next video. Sedentary lifestyle is something that we should also put into consideration. You can't be smoking, taking alcohol, taking drugs, hard drugs for that matter, overdosing on painkillers, misusing painkillers. As an hypertensive person, you're not taking your medications. As a diabetic person, you're not taking your medications, and you think drinking water is going to solve your problem. I'm sorry to burst your bubble. It's not going to. So while we take lots of water to rehydrate ourselves, let us also remember the other aspects of taking care of our kidney. As a dialysis nurse, I sit with patients on dialysis for hours. Now, most of these patients, they come for their sessions twice a week, sometimes 3 times in a week, and it's tiring. It's not a beautiful sight. It's not a beautiful sight. The pain they go through, it is emotionally draining. It is psychologically draining. It is overwhelming. Like, I can't even find words to describe it. It affects their family. It affects their work. So many of them, they can't even go back to their jobs because of the condition. They can't do anything. They can't help themselves. They can't perform activities of daily living, talk more, work to earn money. This disease condition, this procedure, it eats into their family. And dialysis fee is not 10 naira. Dialysis fee is not 5K, it's not 10K. I assure you. Thank God for Delta State government that's giving us subsidy on each session, so they don't usually cost as much. But still, it is financially draining. It is financially draining. So spend that money 3 times in a week or 2 times in a week. Aside medication, so aside every other thing, dialysis fee is financially draining. So how do we better prevent kidney damage, and how do we better care for our kidneys? If you are hypertensive, please monitor your blood pressure closely and always take your medications. I know it's tiring, popping pills every day. There's this particular medication you take once a day. It's not easy, but please, for the sake of your kidneys, for the sake of your loved ones, for those of us that love you, please adhere to your medications. If you're diabetic, the same thing. It's not easy. They said you should not eat this particular type of food. I know how it feels, but which one would you take? Not eating this particular food or causing your loved ones pain? Which one would you pick? So please, let's adhere to our medications. If you're hypertensive and diabetic, stick to your medications and ensure that you monitor your blood pressure and your blood sugar level regularly so as to keep track if those medications are effective or not. 3, stop abusing painkillers. Stop going to that chemist woman and telling her that my waist they pain me, miss painkillers for me. Stop it. If you're having waist pain, if you're having leg pain, find yourself in a good hospital. Let the doctor diagnose you. Let them run tests. Let them know what's causing that waist pain. Let them know what's causing that leg pain. Let them know what's causing that back pain. You get, and then they'll tell you how better to manage your condition. Instead of you popping pills every day, please stop abusing painkillers. Number 4, drink lots of water. Yes, I said it. Drink lots of water. Not when they've already diagnosed you of kidney failure. That's when you now start remembering that you want to drink lots of water. But now that we're still fine boys and fine girls, drink lots of water. Yes. 5, maintain a healthy weight. Don't go and blow out of proportion. Maintain a healthy weight. Exercise regularly also. This would help your kidneys. Your kidneys are already doing so much for you that you don't even realize. They are working extra time, protecting you, balancing you, and you don't even know this. These are the little things that you can do to assist them so they don't fail. These are the little things that you can do to assist them so they don't give up, because they are going to get tired with the way you are doing things, and they're going to get tired with the way you are smoking, with the way you are taking alcohol. Stop it. Stop. Although there are other autoimmune diseases that could cause kidney damage, yes, other autoimmune diseases that are beyond our control, yes, but still, let's do our best. Let's do our best. Kidney transplant money no be 30 naira. Oh, go and ask. To do kidney transplants is not 30 naira. It's not beans. It's not beans. And most of your families, they don't even have that money. Your family cannot even cough out money for dialysis sessions for a week. So why put them through that stress when you can easily prevent this disease condition? Thank you for listening to Nurse Juanita Dey Talk. If you know this video touched you, do want to share with someone that you care about, someone that you love, someone that you don't want to see on the dialysis bed. And no, please, your dialysis nurse does not want to see you on that bed. Not because she doesn't care, but because she knows how hard it can get. So please, take care of your kidneys today so they can take care of it tomorrow. I'm Nurse Juanita, and I dey talk health wey make sense.